New diabetes weight loss drugs. In 2026, the FDA approved several highly anticipated oral weight loss medications. Number 1, Foundayo, or Forglipron, a once-daily oral GLP-1 receptor agonist developed by Eli Lilly. It offers the convenience of a pill and can be taken at any time with or without food. Number 2, Wegovy pill, oral semaglutide. Novo Nordisk's once-daily oral tablet is the first oral GLP-1 receptor agonist therapy approved for chronic weight management. It delivers similar weight loss results to the injectable version, averaging 16.6% weight loss in clinical trials, and is also indicated to reduce major adverse cardiovascular events. Foundayo, or Forglipron. Oh, the mechanism. Foundayo is a small molecule GLP-1 drug that effectively mimics natural hormones to regulate blood sugar and insulin secretion. Clinical performance. In clinical trials, the highest doses of Foundayo lowered hemoglobin A1C, HbA1c levels by up to 2.2%. For example, if you had A1C of 9%, it would come to 6.8, which is great. The catch. Foundayo was approved by the FDA strictly for chronic weight management. Eli Lilly is still pursuing separate formal FDA approvals specifically as a type 2 diabetes medication. Wegovy pill, oral semaglutide. The active ingredient. It contains semaglutide, the exact same active molecule used in the diabetes injection, Ozempic, and the lower dose diabetes pill, Rybelsus. Blood sugar and heart benefits. At the 25 milligrams weight loss dose, it effectively manages blood glucose spikes and is explicitly FDA approved to reduce the risk of major adverse cardiovascular events like heart attacks and strokes. The catch. Because the Wegovy pill brand name is indicated for weight loss, check with your insurance, as it may not be covered under a diabetes diagnosis. Injectable GLP-1 medications available in India. Wegovy and Ozempic, semaglutide. Novo Nordisk officially launched Wegovy for chronic weight management and Ozempic for diabetes in India. Additionally, Novo Nordisk partnered with Emcure Pharmaceuticals to launch a second semaglutide brand called Povistra to expand distribution outside major metropolitan cities. Mounjaro, tirzepatide. Eli Lilly launched Mounjaro using the multi-dose QuickPen device in India. Through a partnership with Cipla, Lilly also distributes the drug under a second brand name, Urpeak, targeting smaller towns in regional areas. Oral GLP-1 medications, pills. Rybelsus, oral semaglutide. This daily pill has been available in Indian pharmacies for type 2 diabetes management, but it is frequently used off-label for weight loss. The new 2026 oral blockbusters. Eli Lilly is fast-tracking the clinical pipeline to bring its newly FDA-approved once-daily obesity pill, Foundayo, or Forglipron, directly to the Indian market. Novo Nordisk is similarly preparing localized strategies for its high-dose Wegovy pill. Subscribe to my channel and join me as I dive into the world of new diabetes weight loss drugs and see if they can really revolutionize treatment for those struggling with their health. The medical community is buzzing with excitement over a new class of medications that are showing incredible promise in helping people with diabetes shed pounds and manage their condition more effectively. For years, we've been searching for a game changer in diabetes treatment, and it seems we might finally have found one. Living with diabetes can be a daily struggle, especially when it comes to managing weight. The condition makes it tough to lose weight, and excess weight can make diabetes harder to control. It's a vicious cycle that can leave patients feeling frustrated and helpless. Many people with diabetes know how hard it is to stick to a diet and exercise plan, only to see the numbers on the scale creep up. The emotional toll shouldn't be underestimated either. The constant stress of monitoring blood sugar levels, dealing with medication side effects, and facing the risk of long-term complications can be overwhelming. And when weight loss efforts stall, it's easy to feel like you're failing. I've spoken to countless people who've been there, and their stories are heartbreaking. The traditional approach to diabetes management often involves a combination of medication, diet, and exercise. While these methods can be effective, they're not a one-size-fits-all solution. What works for one person might not work for another, and that's where these new weight loss drugs come in. They offer a fresh approach, one that could potentially transform the way we treat diabetes. So, how do these new drugs work? They belong to a class of medications called GLP-1 receptor agonists, which help regulate blood sugar levels and slow digestion. This results in a feeling of fullness, making it easier to eat less and lose weight. Some of these medications have been shown to help patients lose significant amounts of weight. We're talking 10, 15, even 20 pounds or more. The science behind these drugs is fascinating. By mimicking a natural hormone in the body, they can help restore a healthy balance to blood sugar levels and appetite. This not only leads to weight loss, but also reduces the risk of complications like heart disease and kidney damage. It's a holistic approach to diabetes management, one that addresses the root causes of the condition. I'd like to share a remarkable story that illustrates just how powerful these new drugs can be. There was a patient who'd been struggling with diabetes for years, trying every treatment under the sun without much success. But when she started taking one of these new medications, the results were nothing short of astonishing. She lost a significant amount of weight, her blood sugar levels stabilized, and she reported feeling more energetic than she had in years. Her doctor was thrilled with the progress, and the patient felt like she'd finally found a treatment that worked for her. This isn't an isolated case either. There are countless stories like this one, and they're a testament to the potential of these new drugs. Of course, as with any medication, there are potential side effects to consider. These new diabetes weight loss drugs offer a beacon of hope for those struggling to manage their condition. They represent a major shift in our approach to treatment, one that could bring significant benefits to patients. I'm excited to see where this research takes us and how it might change lives. If you've got thoughts on these new treatments or have experienced them firsthand, I'd love to hear from you. Leave a comment below and let's keep the conversation going. Thanks for watching. Do not forget to subscribe and click the like button. And if you're looking for more information on managing diabetes, check out our video on the top foods to help lower blood sugar levels.